Well, back home, and maternal health is an important indicator of the health of a nation. Now, Mandera County is reported to have the highest maternal mortality rates worldwide. Now, statistics worse than war-torn countries. This has been due to several factors. Top of the list is that since independence, the county was underdeveloped due to marginalization. Certain strides have been made in partnership with development partners to improve the health of its women. One such initiative is a community life center dedicated to women and children's health. Dr. Mercy Korir has that report for us. Of course, actually we have Dr. Mercy Korir herself right here in studio with me. Of course, she is our in-house health specialist. Good morning, Dr. Mercy.
Good morning, Yusuf.
I hope you're keeping warm. It's a very cold morning.
Oh, yes, I am.
So, can you give us a rough picture of how this situation is like in Mandera?
Okay, well, Mandera, from the Kenya Demographic and Health Survey of 2014, is said to have 3,795 maternal deaths per 100,000 live births per year. This means that there are 3,795 households whose mothers have died either due to pregnancy or while giving birth or after pregnancy, just during the whole period of pregnancy. And this, they've said, is even higher than, as you said, war-torn countries, because we have Afghanistan, which reports about 1,900 of these statistics. So Mandera is actually doing badly. And one of the reasons why it's been very bad for Mandera is, one, the cultural practices of FGM. Women do not seek family planning services. They do not have health facilities, adequate health facilities. And what we picked from the ground yesterday is that, well, before they had about 52 health facilities, but out of this, that was in the entire county, only 10 were actually functional. So you can imagine many women could not be able to go to a health facility and seek antenatal care services, or for safe and safe delivery supervised by a skilled health personnel. We have the traditional birth attendants, where you find that in Mandera County many women opt to deliver at home. The infrastructural challenges that are there, where accessing actually health facility is a challenge, so many women prefer to stay at home. So these challenges have actually been there for the last 50 years, ever since independence. And now many people are now going into Mandera because they've seen that with this kind of statistics, how many children are deprived of their mothers, how many households are deprived of a mother.
It's clearly a very big number. Now, Dr. Mercy, of course, these challenges are informed by marginalization, something that has affected not just Mandera but the entire northern Kenya region. But we have some sort of a devolved set of government. Health has been devolved. It's well funded. Is the problem still there?
Actually, since the devolved system is now where Mandera has actually now started improving. Remember that with the devolution, there's the area in Mandera called Takaba, where they had their first cesarean section ever since independence. And that's how now devolution has actually taken the health services closer to the women who need them. The county government has been able to improve the number of health facilities. They have improved the access routes to those health facilities, where before they did not have roads. At least now they have some all-weather kind of roads that people can be able now to go to facilities. They've been able to provide ambulances, where before they were telling us that they used to use the lorries that ferry items from the quarries or motorbikes for health services. So they have been able to really improve a bit and improve the services that they are offering to women. Yes.
Dr. Mercy, you were there yesterday in Mandera, right? It's I think one of the largest counties in Kenya. I think the second, or is it the third largest county in Kenya? So in terms of distance, is it one of the factors that is contributing to maternal health?
Oh, definitely.
Distance from health facilities.
Definitely.
And what are they doing about it?
The distance to the health facilities has been a challenge, and what they've done about it is just to improve the road network to all-weather roads. They're not tarmacked, but at least now they're all-weather road. They are motorable. So they've been able to improve that, and then they've been able to build new facilities, and they have improved their staff 400-fold, where before they had less than 50, now they have almost 832 healthcare personnel in the county. So these are small strides and small wins that they've been able to bring to the county, so that people don't have to travel like 60 kilometers to the Ethiopian border to seek services, or almost 300 kilometers to Mandera town, where they could be able to seek specialized services when they are in need of this.
And of course, the elephant in the room is the rampant cases of insecurity there. We do hope that both the national government and the county governments are going to work together and resolve this matter once and for all. Of course, Dr. Masi was in Mandera yesterday. We're going to look at her report or watch her report at our 3 p.m. bulletin. You don't want to miss that. For now, Trixie Ngando is with